I'm Dr. David Hill, and today we're going to talk about how to remove earwax in infants. Now, this is a concern that I get from a lot of parents in my pediatric practice. They see wax in the infant's ears, they're worried it might be causing some sort of problem, and they want it out of there. Almost always, earwax is good for an infant's ears. And let me show you an ear model to show you what I'm talking about. This is the external auditory canal that ends in the eardrum. This is some very sensitive, delicate skin that lines this canal and needs to be protected from the outside world. That's what earwax is for. It's there to perform a protective barrier against dirt and even insects that may want to get in here. It also is slightly acidic, and so it forms a barrier as well against microbes such as bacteria or fungus that might infect the ear canal, causing otitis externa or swimmer's ear. In fact, one of the frequent causes of infections of this area is not having enough earwax. Now, the neat thing about the skin of the ear is that it actually grows outward slowly, forming a little conveyor belt that carries the earwax out. So if you see some earwax in the child's ear, all you need to do is wash it out with a washcloth and let nature take care of the rest. You almost never see an impaction of wax in an infant's ear. How might you get an impaction of wax in an infant's ear? Our old friend the cotton swab, or Q-tip. If you start sticking this in here, you're almost guaranteed to drive wax into the ear. It'll get stuck right here where there's a narrowing or a little twist in the ear canal, and when I look into ears, I often see the impression of a Q-tip, sort of this impression that's just in this hunk of wax that the parent has gradually been packing down into the ear canal. That's a lot harder to get out, so the best way not to get that is to avoid it. Now, if your doctor looks in the ear and sees that there's too much wax or is trying to diagnose an ear infection, he or she may use a Curette, something like this, and always watching what he or she is doing through the otoscope to make sure that we're not causing any form of damage or hurting the eardrum or driving the wax farther in. Now, this is tricky under the best of circumstances. Sometimes it still causes pain or even bleeding, even when the doctor's using perfect technique. So it's something we try to avoid, but occasionally if we're trying to see if there's an ear infection, it's something we have to do. So, wax in infants' ears, best advice, leave it alone. Use a washcloth to wash out the outside of the ear. Know that nature is going to help bring that wax out. And if you're really worried about pain or drainage from an infant's ear, you're going to want to take him or her to see the doctor. Talking about getting wax out of infants' ears, I'm Dr. David Hill.